What's up, moms? Welcome to Mom's Diary. This channel will mainly be about pregnancy, lifestyle, and parenthood. When entering the third trimester, pregnant women need to be more aware of the time of delivery. One method is to learn the signs of labor. Signs of going into labor that pregnant moms should know. The signs of going into labor may differ from one woman to the next. Even the same woman could have different signs of labor each pregnancy. But there are some signs that could be felt by pregnant women when the time to give birth is coming, which are 1. Water breaking. Water breaking is usually the first symptom that all women experience. This condition is usually associated with contractions. In general, women will give birth within 12 hours of their waters breaking. For women who did not experience it, the baby may have to be induced due to the high risk of infection. 2. Contractions. Contractions can also be one of the signs that you are going into labor, especially when the pregnancy is entering its 37th week. But mothers need to know that there are genuine and false contractions. False contractions are usually not intense and can be triggered by hunger or dehydration. 3. Breast milk starts coming out. Other signs of going into labor that are usually experienced by women include breast milk starting to come out. This usually happens in the last few weeks before giving birth. The breast milk that comes out is called colostrum, which is a fluid that is very good for a baby's health because of its high nutritional content. 4. Frequent urination. Mothers could also experience frequent urination when the time to give birth is getting near, because the growing fetus in the uterus could be pressing on the bladder and making the body urinate frequently. To prevent dehydration, drink a lot of water. 5. Changes to walking posture. The enlargement of the womb during pregnancy could affect how a pregnant woman walks. This change could cause a pregnant woman's walking posture to be somewhat crossed. This is due to the hip bones getting wider. However, if your walking posture is bothering you, try to consult with a doctor because it could be a symptom of pelvic girdle pain. 6. Inflammation. Inflammation is also a problem that could occur during pregnancy, especially on the foot. Besides that, the labia could also be inflamed as you approach childbirth. Due to the fetus having come down to the hips at the 37-week mark because of the extra pressure from the vagina and causing inflammation. 7. Excreting thick fluids. When the uterus begins to excrete thick fluids, it is a sign that it's almost time to go into labor. These fluids could be brown or pink and could even be lumps. If you want to be sure those fluids are not due to bleeding, please ask the doctor for an examination. 8. Back pain and cramps. A pregnant woman in labor may experience increased pressure or cramping in the hip and perineum area. Of course, this could also cause pain in the hip area, which is why if back pain and cramps are felt, it could be a sign of labor. These are some signs that you are in labor that all pregnant women need to know. If one or even more of those signs are felt, it is best to immediately go see a doctor. This could also be to determine whether a contraction is genuine or false if the mother failed it. So, if you want to know some tips and tricks, or maybe even some useful stuff to know, subscribe to our channel.